Okay, so here's an interesting case for you. A middle-aged male arrives at the hospital and he's complaining of sudden intense chest pain and breathlessness for the past hour or so. A vitals assessment shows that the patient is tachypneic, hypotensive, and tachycardic. His skin also has a pallid appearance, and his health history is unremarkable. His blood pressure is equal in both of his arms, and the pulses are present in all 4 limbs. His pedal pulses are slightly diminished, but it's hard to tell if they're pathologically diminished or not. There's been no trauma, and his only medical condition is mild hypertension. You decide to send the patient for a CT scan of the thorax with contrast, and you see this. For comparison, here's a normal CT. Take a second and see if you can figure out the diagnosis. Now, don't blame yourself if you find this image a little disorienting. That's because of the unusual diagnosis. The ascending aorta looks fine. However, the descending aorta has not 1, not 2, but 3 lumens. We can even see that the expanded aorta is compressing the left lung, which probably is contributing to the patient's breathlessness. What we're seeing is called a Stanford Type B triple barrel dissection. In cases like these, the blood pressure in the arms will commonly be normal, but leg pulses might be diminished. Congratulations to user Sayavash for identifying this condition. Aortic dissections are commonly confirmed with a CT angiogram or an MRI for extra certainty. Cardiac ultrasound can also be a very useful first step because it can be performed at the bedside, even in the midst of a resuscitation. To make a definitive diagnosis, transesophageal echocardiograms are particularly useful for type A aortic dissections that affect the aortic sinus. The pumping action of the heart makes it difficult to obtain a cross-sectional view of the affected structures, though. Transthoracic echocardiograms are great for looking at the aortic root, but they struggle to accurately see the entire aortic wall. For that reason, transthoracic ultrasounds are good as a screening tool. The best location to see the aortic arch with a point-of-care ultrasound is the sternal notch, and the best location to see the descending aorta is along its length to the left of the midline. The talented team at EMWrap put together a great video on aortic dissection ultrasound that looks at this in detail. We've left a link to them in the video description. Now, in this abdominal ultrasound image, we can see an aortic dissection with the intimal flap separating the 2 lumens. Adding color shows blood flow, and we can see the upper lumen is the true lumen, and the bottom is the false lumen. There are 2 main causes of aortic dissection: chronic hypertension and chronic connective tissue disorders, like Marfan syndrome. A dissection occurs when blood ruptures the innermost layer of the aortic wall, the intima. The high pressure of the aorta then pushes blood into the media, with the remaining intact intima separating the true lumen from the new false lumen. Now, in the case of a triple barrel dissection, a second tear in a separate location of the aorta may occur, allowing blood to enter a second false lumen. This can happen spontaneously, or it can be related to a previous aortic dissection. Aortic dissection can be treated with a combination of surgery, interventional vascular techniques, and blood pressure control, depending on the type and severity of the dissection. With treatment, the false lumen closes, as you can see here in this image, and the patient should be followed closely with routine diagnostic imaging, particularly in the first 2 years post-dissection. We hope you enjoyed this case. Thanks to Figure One DevRad for posting this case on the Figure One platform, and to everyone who participated in the conversation around this case. The link to the case and the discussion with other healthcare professionals is in the description below. Now, if you enjoyed this case, there's an episode of the Figure One podcast called DDX, where 3 patients presented with unusual aortic dissection symptoms. One of these patients' symptomologies consisted of only neurological issues coupled with severe leg pain and weak pulses in just one extremity. Check out the episode titled The Near Miss to hear more about these cases. There are thousands more real-world medical cases on Figure 1, so don't forget to visit us and sign up so that you have access to the most valuable and the most interesting medical cases to help you sharpen your clinical skills.